Hey everybody, it's Nat. I'm going to tell you about my first clinical experience. I'm going to get right into it. The setting that I was in was a skilled nursing facility, a SNF, called Rancho Villa in Rancho Bernardo, and it's considered a subacute care. Okay, what did you find helpful during your preparation for your first clinical experience? Basically, I reviewed the 225 packet, a lot of ProFish stuff, especially there's a chapter in there for the skilled nursing facility chapter. There was a vitals chapter, and the differential DX chapters is what I really reviewed, and any other diagnosis that you'd see at the SNF, like dementia, Parkinson's, CVA, and also another classmate that was just at Rancho Villa right before me. We spoke briefly a couple times about just basic stuff, and she gave me some really good pointers about taking notes on the run, just a lot of stuff like that. But we kind of both agreed that I wanted to do my kind of own experience, so we didn't go too far into depth of preparing for that. And it was great. I just wanted to have my own, just kind of be excited and kind of that ex- not knowing what's coming next. That's what I kind of wanted to create. Another one is, what would you recommend to a classmate who will be completing their first clinical experience in a similar setting to prepare for their clinical rotation? Excuse me. I would recommend reviewing the chapters that I just mentioned for 225. Maybe watch some videos on how to treat patients that are dealing with dementia or Parkies, and practice taking notes on the run. If you go to YouTube, you can see some really good videos of treating different diagnoses like dementia and how you should approach the patients. I would say that the most important thing that you could do is not be scared of the patients in the SNF. They're dealing with some really heavy stuff, and you could be the one that helps them just be by treating them like a regular person. You could treat them like a family member, or that's what I try to do. I try to think about what if this was my mom or my grandma, and how would I want them to be treated in this situation? And that always helps me to have good patient care, even in really tough situations where you're dealing with some really tough diagnoses. Another thing to pay attention to is the way your CI is interacting with the patients, and just pay attention to the overall setting and how PTs, PTAs, OTs, OTAs are interacting with each other, and don't be afraid to ask questions. You guys know I ask a lot of questions, but no stupid questions. Um, Even if there's like an OT or a director of rehab, don't be afraid to come up to them, because this is supposed to be a learning experience for you, so you should use it. Um, Next question is, discuss specific changes you experienced and what strategies you implemented, and did it help with those challenges? Um, Documentation was one. Finding the right words to sound professional, and so we can get paid for skilled care. I had issues with that, which I knew I was going to. So just I was working on that a lot during my clinicals, just trying to find the right words to use. That's something I need to continue to work on. Typing was a big thing for me, which I knew it was going to be a big thing. I'm a slower typer, so I've really been grinding these last couple of weeks to try to get where I want to be with the typing. And body mechanics for me was a big one. I need to work on this because with this population, almost everybody is a fall risk, and I was always making completely sure that no one goes down on my watch. So which at times was a problem for me because my CI would get on me about it. I was just like really careful, putting myself before the patients, just making sure, even if it was awkward positions, I would just make absolutely sure that where they weren't gonna take a fall. So, um, discuss expectations of your CI and facility, such as time management, documentation, patient interventions, and anything else that I think is important. Expectations are that you have about 40 or so minutes with this patient, and you have a whole workload. So usually we were seeing about 10 to 11 to 12 patients a day, and things are always happening that are going to affect the 40 minutes or so. So some patients don't want to be seen when you go get them right away. They have a code brown, which is what you think it probably is. As we had several situations where me and the OTA or OT would go get a patient, try to sit them up, and then we realized that they either had a completely wet bed or had a code brown. So you have to deal with these situations, and in this situation, we got the patient up, was able to, it's hard. You got to get the gable on when this is going on. You have to change their person's clothing, and you're dealing with some tough smells, of course. But it's all for, this is what we got to do, and I don't have a problem with it. So, but I have a kid. I've changed diapers before, so it wasn't a big thing. But all these things are happening, and sometimes you don't get to treat the patient. You'll have a plan, things happen, and then what I had to get used to was documentation for that. Is you have to be real creative when sometimes you go in a room and all you're going to do is go take that person to the restroom and do some gait training. So you have to really get creative with your documentation so we get paid. Okay, and then I would recommend wearing a watch. I always had my Apple Watch going, and I set a timer for like 35 minutes for each patient. And it's because you still have to go back to the PT room and do your documentation within these minutes. So what I would recommend is not to get stressed when it doesn't work out, because at the end of the day, it's all going to work out. You're going to, either find ways to make it work. So try to stick with the timer with every patient, but when it doesn't work out, it's not the end of the world. And the patient interventions are very basic, and the whole class with our class, it would take you probably a couple of days, and all of you guys will be pros with these type of exercises. Next one is, what did you like about your setting, and could you see yourself working with this patient population? This is the only setting that I have experience in. I did a lot more observation hours than I needed to get in this program, because I kind of knew a lot of people that works at SNFs, and I was just going to see if this is something that I really wanted to do, because I had already had an occupation. So I did a lot of hours at the SNF. I did no outpatient hours, so I was pretty familiar with what I was going to get into with this clinical rotation. And yeah, I love working with the Jerrys. I like talking to older people in general, even outside of work, because I just believe that they have so much to contribute. And when you start aging, you tend to give it to people straight, which I love, and that's how I roll as well. Please share your thoughts of being in healthcare during a pandemic. It was interesting. I believe that I was the only student to have to take a little break because of the COVID scare. I did almost 2 weeks, and then there was a COVID scare or outbreak at my facility, so I had to take a 2-week break and then come back. And at first I was kind of bummed, because when I got back, I was preparing, I was looking at all my charting and finding ways that I could progress the patients that I was seeing. And when I got back, there was only one patient that was still there that was on our schedule, or some of them got discharged. And so I was looking at a completely new workload, all new DXs and stuff. But it actually was cool at the end, in the end, because it was harder at first because like the case study that I was going to do, she got discharged and I wasn't able to get the paperwork, so I had to start a new one. But it was challenging, but it was kind of like getting different, whole different set of patients. So it was like a different, whole different clinical. And when I thought about it, which I kind of had more experience from that happening, so that was cool. Um, and yeah, so that's about it. If you guys have any questions, like I said, I have some experience and the sniffs. If you guys go to one, if you guys want to reach out to me, hit me on WhatsApp, email, any of that stuff. Slide into the DMs like the kids are saying these days. And thanks a lot, guys.